it is really hard from adults' perspective to understand what mental health is, what mental illness is in adulthood, let alone in childhood. But I mean, there's broad categories that we use to assess, and we talked just now about what impact COVID might have on kids. There are certain vulnerabilities that might lead you to suffering with a mental illness, or signs that you might have a difference in your brain that might change your behaviour. And these are the things that we kind of assess and look at. And so if you broadly split them into sort of emotional and behavioural conditions and conditions related to the brain, it can be a bit easier to unpick. Okay. And like you say, depression is probably the number one thing that most people understand when you talk about mental illness. That's the first image that's conjured up. But often with depression, there are contributing factors that lead to a person being depressed or a child being depressed. And part of our job is to assess that and look at, are there any underlying contributing factors, and trying to deal with those, because if you don't, it's going to be very hard to treat the mood. And often the mood is a normal reaction to having these vulnerabilities, and so telling somebody this is an illness that we're trying to treat without sorting out what is causing it doesn't make sense. So if we talk about the brain first and what differences can be seen in the brain, and what might come to someone like me that might help. There's this notion of having neurotypical brains. That means having a brain which is a size and shape that's seen very commonly in the population. And then there's people who have slight differences from that. And these slight differences can lead to strength, intelligence, or emotional intelligence, quick-wittedness in maths, quick to tell a joke, these kind of things that the average person can't do. But there's also differences that can lead to difficulties as well. And so if I talk a bit about them, some of the common ones are specific learning issues, and those aren't necessarily identified by people like me, but maybe in the school. So things like dyslexia, dyscalculia, and what they mean are difficulties with words and letters, and your brain sort of jumbling things up. So it's not the fact that you can't read, it's just that when your brain first scans a page, it doesn't put the letters in the right order, or the words in the right order. And so it can often seem confusing when you then translate it in your brain. And dyscalculia is the same thing with numbers. Dyspraxia is another one, and that's related to fine motor control. And what that means is how you manipulate your fingers. And again, it's very different to gross motor control. So kids can often catch, play football, but things like tying their shoelaces or eating or pencil grip, these are the signs. And if your child has these kind of differences and they're spotted early, someone called an educational psychologist is who you would see, who basically assesses all of your child's strengths and weaknesses in terms of their learning in something called a cognitive assessment. It can take up to 4 hours, and then it measures where your kids' strengths are as well as their weaknesses. And if the weaknesses follow a pattern, they might then identify these learning issues.
And then they come to you after that?
Well, with the specific learning issues, they normally have recommendations for the school to implement. So if you have dyslexia, you would have specialised reading classes that might help boost and help you as a person with dyslexia take your time in reading, and things like exams or classroom adaptations might help support the child.